All right, I think we'll go. It is just about 12 o'clock sharp. Uh, so welcome, everyone. My name's Molly Stearns. I'm the Chief Development Officer here at Overlake, and welcome to the Foundation's Donor Circle of Excellence webinar on sleep and sleep medicine. We have 50 people registered for this event, a clear indication that this topic is resonating with people. We are happy you're here, and I think you're in for a treat. It should be a wonderful presentation. And before we get going, and Mike Marsh, our CEO, comes on to make a formal introduction of a welcome, and as well as to our speaker. I want to just go through a few housekeeping items with you. Many of you are old hands at Microsoft Teams at this point. If not, you'll notice that we've placed you all on mute. That will eliminate our background noise as we move through the program this morning. We will also be taking questions at the end. Many of you have sent questions in. Dr. Bonvallet has a lot of those questions, so also be an opportunity to feed them into the chat on the right-hand side of your screen there, and we'll pick up on those and make sure that everybody who has a question gets an answer. If you don't know how to do chat, you'll notice there's an icon on the bottom of your screen. Just select it and then type away, and it'll miraculously appear there to the right. If you're here via phone, you could certainly email your questions to events@overlakehospital.org, and we'll grab them that way as well. So Mike, I'm going to turn it over to you at this point to offer a more formal welcome to this group here and introduce Dr. Bonvallet.
Okay, great. I'm assuming I'm off mute, otherwise somebody would let me know shortly.
You are off mute.
Perfect, thanks. Well, welcome everyone, and thanks, Molly, for those introductory comments. Today, you're in for a treat in this Circle of Excellence presentation that we've entitled The Search for Sleep. And before we get to the main attraction, which is Dr. Bonvallet, I did want to, again, never miss an opportunity to share my deep appreciation for each of you and all that you've given to Overlake over many years, in some cases, in your support and your contributions. You've really stood by this organization as it has grown into really a nationally recognized, highly specialized institution caring for people all throughout the East Side and surrounding communities. So thank you very much for all that you do. And it's part of the reason why you're part of this esteemed crowd that we call the Circle of Excellence. As Molly said, we once again have a great response for this presentation. I think it demonstrates the interest in the topic. Hopefully in the not too distant future, we'll be able to resume these presentations in person. We certainly look forward to seeing your smiling faces up close and personal, and maybe someday even without a mask. You know, now more than ever during this pandemic and all that's come with it, we need to take care of ourselves. And getting quality sleep is a really important part of your overall health and well-being. It's something, I think there's some background. I'm not sure where that background's coming from, but it might be the foundation room. But it is something a lot of us do struggle with, and I think that's demonstrative of the turnout today. As Molly said, you hear from one of our terrific physicians, Dr. Scott Bonvallet. Dr. Scott Bonvallet is the co-director of our sleep medicine program here. He's going to talk to you about the importance of a good night's sleep and the science that supports those best practices that help you recharge your batteries. A little bit about Dr. Bonvallet is that he's been with Overlake for 20 years. We're really grateful to have him. He's a leader in many ways. That's demonstrated by the fact that he has been named top doctor by Seattle Met and Seattle Magazine for many years. He holds 3 specialty certifications. He's a specialist in critical care medicine, pulmonology, and of course, sleep medicine. So Dr. Bonvallet will leave time for your questions, as Molly indicated, and I'm also available for questions if you would have them about other topics that might be on your mind. But I think mostly it'll be about the sleep program, but I'm always happy to entertain any questions people might have directed towards me. So with that, I'll turn it over to Dr. Bonvallet, and again, thank you very much for participating in today's event.
All right then. Well, thank you, Mike and Molly. Yeah, I can't believe that February 1997 was when I first came on board at Overlake Medical Center, and as Mike pointed out, I'm also a pulmonary and critical care physician at Overlake, and have been fortunate to be here for over 20 years. I'm obviously a bit biased about Overlake because I've been here for so long, but it's a great place, and I appreciate everybody coming to listen. I think I actually recognize a handful of names on the list of attendees as well. So with that, why don't we go ahead and advance to the next slide. So the Overlake Sleep Disorder Center, we opened in 2005 and have been accredited by the American Academy of Sleep Medicine since that time, which is a significant distinction, I will say, and a lot of work to become accredited, noting that not all of the sleep centers that are out there in the United States are accredited, but there's specific steps that we have to go through to become accredited. We're a full service facility. We provide evaluation, diagnostic testing, and treatment. And as I say on the slide, under the same roof, which is helpful, I think, for our patients. We have, as it says, a full service durable medical equipment department that is for patients that have sleep apnea. We provide CPAP therapy, and again, that's helpful so that if patients have problems with their CPAP devices, we address them at the Sleep Disorder Center. We have two very experienced respiratory therapists that help patients with their CPAP setup. We have 3 providers at our sleep center that are all board certified specifically in sleep medicine, which includes myself, Dr. Randeep Singh, who has a certification as well in neurology, and then Dr. Ruben Walia, who's also board certified in family medicine. Next slide. So we treat basically all sleep disorders. There's technically 84 specific sleep disorders out there, most of which we treat. And that includes most commonly disorders like insomnia, snoring, sleep apnea, narcolepsy, restless leg syndrome, and as we say, circadian rhythm disorders. That's a phenomenon where patients' internal clocks are shifted either clockwise or counterclockwise. And then what we call parasomnias. As you probably know, in medicine, we give fancy names to things to make us sound smart, but that includes things like night terrors, sleepwalking, things like that. Next slide. So why is sleep important? Well, first of all, sleep is important when we're children as it pertains to our growth. It's been shown that during the deeper stages of sleep is where we predominantly secrete growth hormone, which is important both as we are children, but also in things like insulin resistance and tissue repair and things like that. It's also very important as it pertains to our immune function. There's numerous studies that have been reported in the literature showing that response to vaccinations like the flu shot is impaired if we're sleep deprived or we have a significant untreated sleep disorder. And we think the same thing as it pertains to the COVID infection, which we'll talk about in a couple of slides. Sleep's also important in memory consolidation and executive function. as mentioned, it repairs the damages of the day. I'll never forget a airline pilot where I was talking to him about sleep and how it's reparative, as we say, and he used the analogy of commercial airliners where those that are flying during the day, they at nighttime or other times during the day are being repaired so that they can fly again the next day. It's also known to or been shown to improve our ability to focus and concentrate. Studies have shown that about 1/3 of both kids or adults that satisfy diagnostic criteria for attention deficit disorder or ADHD have a sleep disorder as the primary cause. Also, sleep, as we know, when we're up all night or we're stressed or not sleeping well, we're a little bit cranky, and so it improves our mood. Also, good sleep helps with weight loss, and conversely, not getting enough sleep can contribute to weight gain. And then we now know and have known over the years that poor quality sleep can increase risk for cardiovascular disease and cancer and dementia. Truthfully, I went into sleep medicine kicking and screaming when I first came to Overlake, in that I was all about taking care of patients in the ICU and had the certification in sleep medicine. But as more data came out showing, for example, the link between sleep apnea and heart disease was significant, I came on board 100%. Next slide. So this is an interesting slide that's been shown in other talks over the years, but I thought this was interesting in that it showed that the average sleep need of various organisms, so to speak. So as you can see up at the top, bats sleep about 20 hours per day. Cats are and dogs as well, are about 12 to 14 hours a day. We inherited one of my son's cats, and that thing just slept constantly. And I didn't realize that was a normal thing, but they spend over half their day sleeping. Further on down, one thing that I didn't realize is that on average, horses sleep only about 3 hours per day, which I found to be interesting, particularly since they're such large animals. But that's what's considered to be the average sleep need of horses. Next slide. So I don't want to go into too much detail just because of time about sleep stages, but we basically now have what are recognized, and this is an older slide, but 4 sleep stages. On this slide, on the right-hand side shows stage 5, which is now called Rem Sleep, and then stages 3 and 4 we now lump together. But if we go back to the left side on stage 1, so stage 1's our lightest sleep stage. It's the stage of sleep that we typically, when we first go to sleep, go into. We're more easily awakened during stage 1 sleep. Sometimes you can carry on a conversation with someone in stage 1, and they may or may not recall that conversation. And it accounts for maybe about 5% of our time asleep. Stage 2 is a deeper sleep stage. It's our largest sleep stage. It accounts on average for about 50% of our total sleep time. It's been shown to be responsible in part for executive function and tissue damage recovery, things like that. Stages 3 and 4 we now also call slow wave sleep. So it's the deepest sleep stage. Sadly, starting at age 30, we start having less and less stage 3 and 4 sleep or slow wave sleep. Kids have a ton of slow wave sleep. That's why, as I think all of us that are parents know, that it's when you're waking your kid up to go to school in the morning that if you don't make sure they get up out of bed, they're right back to sleep and they don't remember you having come into the room. But it varies. So at age 30, a normal amount of stage 3 and 4 sleep is about 20% of our sleep time, and then age 70, it's maybe 5 to 10%. And then REM sleep is really the fascinating sleep stage. It's the rapid eye movement sleep, where while we're asleep, our eyes are moving quite rapidly. It's our dream sleep stage. What's remarkable about stage REM is that our brain metabolic activity during REM is actually greater than wakefulness, and which still to this day I find a very fascinating thing. And so that's why, for example, if you're awakened out of stage REM, typically you're pretty quick to be able to respond to questions or perform complex tasks. Number of years ago, the ICU nurses sort of did a roast of us ICU docs and what we were like in the middle of the night when we were called, which was quite entertaining. But one of the things that they said and it was that there were times that they would call us and that they would have complex data to give us, and we were spot on, able to assimilate the information they were giving us and give orders that made sense. And then other times, a little bit slower to respond. Sometimes would call them back 5 to 10 minutes later after we cleared the cobwebs. And it's simply a matter of what sleep stage you're awakened out of. But REM sleep is our most important sleep stage. It's most responsible for immune function, short-term memory consolidation, things like that. Next slide. So this is just a graph looking at the different sleep stages. I don't think I have an arrow with this, but so we cycle in and out of REM sleep in particular about every 90 minutes. And up at the top in the green is REM. So each cycle of REM typically is we go in and out of REM about every 90 minutes, and each cycle is a little bit longer. And REM typically accounts for about 20% of our total sleep time. The good thing about REM is that as we get older, it decreases a little bit. Like if you're over 70, it's about 15%, but unlike stage 3 sleep or slow wave sleep, it doesn't decrease that much with age. Also, as you can see, after REM sleep, where there are those circles that are in the light green, we have transient awakenings. And the reason for that is that basically our brain is going from, as I say, high function, high metabolism into a lower metabolic state. And so we all wake up transiently as we go from REM to non-REM sleep. And sometimes people are aware of those awakenings. And that's why, in fact, seldom do we see people that, at least adults, that say that they'll sleep the entire night through without waking up. Next slide. So this is just a slide that's a little bit hard to read, but it depicts our sleep and our circadian rhythm. And if you look at over on the left side of the slide where it starts at 12, which means midnight, during that time, most of us hopefully are sleeping. Our urge to sleep as the night goes on, if you go along the x-axis, as we get more sleep, our sleep urge goes down, and then our sleep need, if you look at 6 a.m., our sleep need is, and everybody's a little bit different, but this is sort of a generalized slide, is at its least. And then as the day goes on, it also shows something that we call the circadian dip. And if you look at just after noon, our sleep urge goes up. And it has nothing to do actually with eating lunch, but that's why most people are sleepiest or have this period of sleepiness during the day a little bit after lunchtime. And it's interesting in that there have been some studies that have shown that the interval of time that motor vehicle accidents are the most common are between noon and 3 in the afternoon, which is pretty remarkable because that's not when rush hour is occurring. Typically, those that are working are at work, but some people attribute that to the fact that that's our sleepiest time during the day. Next slide. So this is just a slide that looks at sleep duration recommendations, and it shows that, for example, all of us that have had children, that newborns, they sleep a lot, typically 14 to 17 hours per day. Our sleep need diminishes as time goes on. I'll point out under teens that their sleep need is typically 8 to 10 hours per 24 hours, but show me a teenager that gets that much sleep. Mine never did, and that's actually why teenagers are a population that's more sleepy technically than other populations, and that, of course, also relates to increased risk for motor vehicle accidents. As we get older, our sleep need decreases. So as you see on the right-hand side, older adults 65 plus and older 7 to 8 hours. One thing that's important to note is that it doesn't mean that as we get older, we don't need as much sleep. We just don't sleep as deep and are not capable of sleeping longer. Next slide. So I won't spend too much time on this slide because I think that I already went over it, but basically on the left-hand side of the slide, it shows that it breaks sleep down into wake, REM, and non-REM sleep. And the point is that as we get older, we have a bit less REM and less non-REM sleep, and we're more awake during a 24-hour period. Next slide. So this is from a talk I gave a few years back just on sleep deprivation, which was really informative to me in that there have been some significant world catastrophes that have been associated with sleep deprivation. And these include the Space Shuttle Challenger, the oil spill with Exxon Valdez, Chernobyl, 3 Mile Island, and the Bhopal gas tragedy. But I think the first two are probably the most memorable to a lot of us. Next slide. So the Space Shuttle Challenger tragedy was one where after the NTSB reviewed all of the data, and this was not very well publicized, but what they discovered, they brought in a third party to look at what occurred during the Space Shuttle Challenger. And I think those of us that remember the Space Shuttle Challenger, it had been delayed several times. And so NASA was being heavily pressured to get the shuttle off the ground, so to speak. And what they discovered in this third-party review is that they had, and they discovered this 3 days before the launch, is that they had evidence of defective O-rings, quote unquote, in the rocket boosters. And when they had these third-party aeronautical engineers look at the event and these issues, they were shocked that they didn't postpone the liftoff. And it was felt ultimately they looked at the engineers that were working for NASA, that were responsible for all of this, and they got information as far as their average amount of sleep in the previous week before the liftoff, and it was under 4 hours. And so ultimately, sorry, I have a frog in my throat here. Ultimately, it was decided that a primary contributor to the tragedy was sleep deprivation in the NASA engineers. And, I don't know if any of the audience had heard that or not, but it was something that was, I think, hidden from the public, but it was attributed to, or largely attributed to, sleep deprivation. Next slide. So another example is the Exxon Valdez oil spill, and I think those that remember this as well will likely recall that the cause of the oil spill was the captain who had a known drinking problem and had been drinking before before the oil ship ran aground. And in fact, the captain of the ship, in my previous talk, his picture of him was on the cover of Time magazine as sort of the cause or the culprit in the oil spill. And it turns out, as some people may be aware, that he actually, despite having been drinking, actually navigated the ship quite well. And then what happened is that the third mate took over at about midnight, and about 25 minutes later ran the ship aground. And they looked at it more closely, and he'd only had about 4 hours of sleep in the previous 3 days. And so ultimately it was determined that it was sleep deprivation in the third mate as the cause of the oil spill, despite the captain being implicated because of his alcohol use. Next slide. So I just wanted to first talk about, as we describe it, proper sleep hygiene. And a lot of us take this for granted, but and it's particularly important, as we'll talk about, as it pertains to the pandemic, but that it's important that we all try to make sleep a priority and to reserve at least 7 hours per night or day, if we're working nights, for sleep. It's also very important that we maintain a regular sleep schedule as it pertains to bed and awakening times, meals, work, social contacts, things like that, because our brain is very much wanting to be on a schedule, and different times as it pertains to our meals and exercise, and obviously bed and wake times can very much affect our sleep quality and depth of sleep. It's also important that we try to get natural light exposure during the daytime to help regulate our sleep-wake schedule. So the wavelength of light that we get by being outside specifically stimulates a nerve ending in the retina that helps wake us up. And so, for those people during the pandemic that are staying inside and not going outside, that can affect their sleep quality. Avoid using electronic media within 2 hours of lights out. That's become a bad habit, I think, for all of us, and particularly younger people. Exercise or regular exercise. It's been shown that even just 30 minutes of exercise per day will increase our deep or our stage 3 sleep. It's also important for us to give ourselves at least 1 hour before we turn out the lights to go to sleep, to wind down and not do work-related tasks right up until we try to go to bed. And then do not watch your clock in the middle of the night. I think that whomever invented the clocks that project in 4-foot tall letters on their ceilings likely, works for one of the sleeping medication pharmaceutical companies. I mean, that's the worst thing that anybody can do, is sit there and stare at their clock in the middle of the night. And then it's been shown running a room temperature in the low 60s helps promote sleep and helps promote us staying asleep. There's obviously some variation in different individuals. And then lastly, avoid large meals within 3 hours of bedtime. Next slide. So to talk a little bit about sleep and mood disturbance, during the pandemic. As many of you probably read, it's common. There have been several studies that have now been published of people that did not have a background history of depression or anxiety, that at least 50% satisfy the diagnostic criteria for mild depressive or anxiety disorder. About 1/3 of individuals that have been surveyed have endorsed symptoms related to, as we say, anxiety disorder. A similar number have described issues both with insomnia, both problems getting to sleep and staying asleep. And then, alcohol consumption has increased, as most of us know, during the pandemic, and that contributes to both difficulty sleeping and mood disorders. Next slide. So what contributes to sleep issues and mood disturbance during the pandemic? I mean, a lot of them are obvious. There's the obvious stress, whether it be financial or job security, having to homeschool children, and then of course, fear of either, the individual or their family members of contracting COVID-19. Social isolation, I mean, that's a big deal for people. I've seen numerous patients that haven't seen their grandchildren for over a year, and that's very difficult. Working from home, some people like it, some don't. And we found that people that are working from home have a tendency to have a different sleep and wake schedule, often going to bed later and then waking later. As I mentioned, less natural light exposure and then less exercise overall. Next slide. So how can we mitigate the adverse effects of the pandemic on our sleep? Some of it's what I talked about before, so I won't go through them all. I think it's important to adhere to a schedule, and in fact, I think that it's important for people that are working from home to try as best they can to sort of simulate a similar schedule, realizing that those that have younger children that they're having to homeschool. It makes that a little bit more difficult. And then importantly, for those that are, feeling that they're depressed and anxious, that they need to seek help, and whether that be probably first reach out to their primary care provider. Next slide. So there were a few questions that asked about natural sleep aids and in what are felt to be beneficial, what are not. As most of you know, there are a lot of them out there: melatonin, L-tryptophan, valerian root, even magnesium. One of the difficult things with any type of natural "quote unquote" remedy is that they're not regulated by the FDA or have to be shown to be effective or safe because they're released as supplements, which is something I've never fully understood. And as many of you are likely aware, there are supplements that have been released in the past that ultimately were proven to be harmful, and then FDA stepped in and took them off of the market. Unfortunately, there's not a single supplement that has been shown in, as we say, randomized controlled studies to improve sleep as compared to placebo. Although melatonin is probably the most commonly used, and it has been shown to be effective in some individuals who have, as we talked about a little bit, circadian rhythm disorders, where their internal clock is either shifted backwards or forwards. And one of the problems with melatonin is that it does not cross the in some people the blood-brain barrier, and that's why in some people it's been shown to be effective, others not as effective. We're familiar with that phenomenon as it pertains to antibiotics for meningitis. So there are certain antibiotics that are great for a specific bacteria when it causes pneumonia, but don't have any efficacy when it comes to that same bacteria causing meningitis because it doesn't cross the blood-brain barrier. Next slide. So there were some submitted questions. I'm going to step out for 1 second, get something to drink. I apologize. It's got a frog in my throat. I'll be right back.
So while Dr. Bonvallet is getting something to drink, please remember to if you don't see a question up there that you'd like answered, to type them into the chat, and we will try to get through as many of them as we can.
Molly, I just want to say I really appreciate these programs. They're so informative.
Oh, well, good, thank you. And we'll want to, we'll be sending out a questionnaire at the end, Kate, so we can make sure that we're still, that we're providing the kind of topics, coverage of the topics that you want to hear about. So please keep giving I mean, this was a result of people wanting to know about sleep. So we want to make sure that we're continuing to listen and provide information on topics that are relevant and important. So thank you.
I'm back.
All right.
I apologize for that. So, so we received some questions last week, and I'll go through these and then entertain other questions. Just to go through the questions that some of you submitted.
Oh.
Okay.
Done that.
Somebody, Dr. Swanson, can you mute?
Yeah.
Thank you. Thank you. Great.
Okay.
Okay, good.
So, one of the questions was, I wake up every 2 hours, and is this something seen in IPF, which is known as idiopathic pulmonary fibrosis? So as I talked about earlier, our REM cycles are typically like 90 to 120 minutes, and we will often transiently awaken out of REM. So it would not be abnormal to wake up every 2 hours and be awake for maybe up to 15 minutes. So that wouldn't be abnormal. And then is this something seen in pulmonary fibrosis? Not specifically. There's a little bit of evidence that when we go into REM sleep, our muscles are very relaxed, if not nearly, our arms and legs nearly paralyzed. And so it affects the diaphragms as well. So sometimes you may drop your oxygen level a bit in REM sleep if you already have abnormal lung function, but it's not a phenomenon specific to IPF. So the next question was, I usually wake at 3 a.m. when I sleep early and I am tired the next day. How do I manage sleep time? So I'm not sure I know exactly that question, what's being asked. I don't know if you are going to bed early, and so you're waking up, if you're, for example, going to bed at 9 p.m. and waking up at 3 a.m. Or not. So typically, like I say, when you're in REM sleep, you will wake up, about every 90 to 120 minutes. I think just based on the question, when you sleep early, it might when you sleep early, it might suggest that you have some nights that you're going to bed later and other nights earlier. And so if you do that, it will throw off your sleep schedule a bit. Third question, if someone wakes up very early feeling great after 6 hours of sleep, is that okay? The answer is yes. Everybody's a little bit different as far as their total sleep need. Often at 6 hours of sleep, you've filled the tank a fair amount. Also, we have more Rem sleep during the second half of the night. So if we wake up out of Rem, we're more alert. So so everybody's different. Next, another question was after radiation treatment, my sleep has been broken up. I get 2 to 3 hours at a time. Any solutions? So radiation therapy has been shown to affect sleep. We don't know exactly why that is. The good news is that typically it resolves or gets better after radiation therapy is completed. So point is that maintaining good sleep hygiene, I think, is important. I would stay away from prescription sleeping medications, at least for any prolonged period of time that is more than a week or two. Another question was, does low versus high carbohydrate supper have an effect on sleep? So the short answer, not really. It is interesting that a few studies, because I didn't know the answer to this question other than I've not seen much on it, and so I looked it up, and curiously, it's been shown in some studies that higher concentration carbohydrates at nighttime, which of course is not a good thing as far as weight gain goes, but increase our Rem sleep a little bit. But I think that it doesn't really matter. I think the more important thing is to avoid eating within 3 hours of bedtime. Another question was, does weight loss help eliminate OSA as obstructive sleep apnea? And yes, it does. One of the things in sleep apnea is that definitely weight is a contributor, and in some people, the primary contributor. So everyone is different. We found that once you have sleep apnea, that it's hard to lose weight, and some of it has to do with the fact that you're not getting as much Rem sleep, and we make a hormone in Rem sleep known as leptin that helps boost our metabolism and burn calories. And so when you have untreated sleep apnea, you don't make as much leptin. So we've seen lots of patients who have sleep apnea that get treated or go on CPAP. Now they've lost more weight than they've ever been able to lose, and their sleep apnea is resolved. Another question was, can meditative states replace or duplicate some of the benefits of sleep? If I'm interpreting this question properly, I don't think if somebody's meditating, they may or may not at times being going into maybe stage 1 sleep. But all that being said, I think that for those that do like to meditate, it very much helps with more sound sleep and ability to initiate sleep. So meditation is a good thing for those that do it. So next question was, not sure if I snore, and is snoring with sleep apnea harmful? So I presume that and I think I meant to say without sleep apnea harmful, but I presume that you don't have the person that submitted this question doesn't have a bed partner. To answer the question, is snoring by itself harmful? Definitely, we've seen over the years when we've done sleep testing on people where we're looking at their depth of sleep and measuring their snoring and their breathing. that we'll see that their snoring is interrupting their sleep. I've seen people where they're pulled out of a deeper sleep once a minute, just simply from their snoring, and did not have sleep apnea. And so those people, typically, if you do some sort of intervention for their snoring, will report that they sleep better. Does meditation help with sleep? I think I already answered that in a previous question. Does melatonin help with sleep? Again, I think it depends on the individual. One thing that if you're taking melatonin for insomnia-like symptoms is that you want to simulate your natural melatonin production. So what melatonin does is it helps coordinate the sleep process. So it doesn't itself directly promote sleep, but it helps synchronize the sleep onset process in the release of chemicals that help us go to sleep. And so typically we start making melatonin about 2 hours before our sort of biologic sleep time. So if you're going to take melatonin, it's best to take it about 2 hours before you want to turn out the lights to kind of simulate, a normal melatonin release process. But again, some people, melatonin doesn't work for them at all. So another question was, when is it time to see a sleep specialist? Well, it depends. I mean, if I think that, for example, if you have been noted to snore loudly and stop breathing by your bed partner and feel tired during the day despite getting 6 to 7 hours of sleep, that would suggest that you may have obstructive sleep apnea. That would for sure be a scenario. If, for example, you are feeling sleepy on a regular basis despite getting at least 6 to 7 hours of sleep per night, and it affects your cognitive function or your mood, that would be an example. As far as insomnia goes, it's hard to delineate exactly when somebody should see a sleep specialist. I will say that the longer you have trouble sleeping, the longer it will take to get better. And so if, for example, you're having troubles where you estimate that it takes at least 60 minutes to get to sleep, and you're awakening 2 or 3 times during the night, not getting back to sleep within 30 to 60 minutes, that it'd be worth at least reaching out to your primary care physician about a sleep consult. And then lastly, what does a sleep assessment entail? So if somebody's referred to the sleep center, for sleep evaluation, it depends on what the issue is. So for example, if your issue is more insomnia related, then we don't typically do sleep testing, or at least overnight sleep testing here at the sleep center on those folks, because as you might guess, they'll sleep probably even worse if they don't sleep very well at home. So it depends on what we're evaluating. The traditional type of sleep study is what we call a nocturnal polysomnogram, and that's where people would come in here, spend the night. We monitor your brain waves by EEG, your breathing, heart rhythm, things like that, and are able to look at how deep you sleep, and again, realizing that it's not like sleeping at home. The way we've derived normal data is by taking normal people and subjecting them to the same sort of sleep testing, but and that we do most often for things like sleep apnea and narcolepsy, restless leg syndrome. We now also do home sleep testing, particularly for sleep apnea, where you're tested in your home environment. You're not hooked up to as many wires. It's more comfortable. The downside is that it typically doesn't measure your depth of sleep and assess for other types of sleep disorders. and we'll have, in some cases, about a 20% false negative rate. So we've had people that clearly had sleep apnea, but the portable sleep testing was technically normal. But I'm a fan of it because people are more comfortable being tested at home. And I think it's a good start, particularly for sleep apnea. We also have a testing device that does a limited EEG. So we're able to have people tested at home. It's not quite as accurate, but we've only been using it for about a year. So it's helpful as well. And those people where bringing them into the sleep center is something that's either just not feasible or pretty clear that they would be uncomfortable undergoing an overnight sleep study. Next slide. I think that's it.
Scott, a question popped up. There are a couple of questions that have popped up that you haven't hit on, some that you have. So I've jumped to the couple that don't. First has to do with how you, as a physician, how doctors and surgeons and anesthesiologists, people who are typically up during the night a lot, how do you cope? How do they cope with sleep deprivation?
Well, that's a great question. I mean, the scary thing is that there have been numerous studies published showing that functionally, if you've been awake for 24 hours, that your cognitive function and eye-hand coordination is equivalent to having a blood alcohol level of 0.1. And so, so there's been a lot of push to limit both residents and interns as well as practicing physicians' hours. So we, for example, in the ICU, we do our call in 12-hour shifts, and that's helped quite a bit. But I think that recognition of what good sleep hygiene measures are and know what our limitations are is important, but I still think we could do a better job. It's better than it was 20 years ago, I will say. So
yeah. All right, here's one. How are naps good for you? And if so, what's the ideal duration?
Yeah, that's a great one. Partly because I love to nap.
Well, that must mean they're good for you.
Yeah. So first off, most people will say not to nap more than 60 minutes, and some will say no more than 30 minutes, partly because if you go beyond a certain amount of time, you start going into that slow wave sleep. And when you wake up out of slow wave sleep, you're groggy. You don't feel as good. And so that's the idea of as they say, the cat nap, so to speak. And so, and they've done studies. They did a study 10, 12 years ago in Europe where they took people without sleep disorders. They were young. I think average age was like 35. And they were all people that were getting at least 7 hours of sleep per night. And what they first did is testing of sort of cognitive functioning between 5 and 6 in the afternoon. And then they had them take a 30-minute nap, like between 1 and 1:30 in the afternoon or so, and did that for a couple of weeks and repeated that testing. And there was a significant improvement in their performance on the cognitive testing done later in the afternoon. So, I'd love to be able to take a nap every day. I don't, but naps are good things. And just to add to, we talked about that circadian dip after lunchtime. That's the best time to take a nap.
All right. Well, I think my boss is here. I'm going to say, Mike, don't call me between 1 and 2. Here's Pauline Bach is asking, what about using a Fitbit to check sleep? How accurate are they?
Well, I have a love-hate relationship with Fitbits. I think that most of those activity monitoring devices are pretty decent at differentiating wake from sleep, because we definitely move more, because most of them use accelerometer, and it's based on movement or not when we're in bed. And so I think that they're pretty decent at differentiating wake from sleep, but not very helpful at depth of sleep. And that's the hate part of it, is that, I've had people that get a Fitbit for Christmas and it says they're not getting any REM sleep. And then it kind of takes a life of their own. I mean, they're now all worried about their sleep. And for a lot of people, insomnia is a mental thing. And so that's the part of it I don't like. But I think that most of them are decent at telling whether you're awake or asleep.
I think the final question here was sent in, but I didn't get over to you because just came in later this morning. If my sleep is interrupted due to body heat or body chills, what can I do?
Well, like I say, running your bedroom temperature lower is helpful, like in the low 60s. Definitely a disorder that, like a lot of things in women, doesn't get a lot of attention as it should, is perimenopausal or postmenopausal sleep disturbance, which the bottom line is common. And so there are certain medications that we'll give that for one of which is gabapentin, which historically has been used for neuropathy in people that have perimenopausal sleep disturbance or night sweats, whether it's from hormonal therapy or not. But keeping the room temperature at night, I think, is helpful.
Mm-hmm. That's great. Thank you so much. The questions that are left, pretty much you have answered. And this has just been really fascinating. I want to just add my thanks to Mike's earlier comments about how important all of you are as donors to Overlake, and in our ability to continue to deliver world-class care, as we say, to our East Side patients and families. I mean, we really just couldn't do it without all of you here in the room today. So thank you again. As we mentioned earlier, please give us your feedback. There'll be a survey coming out. We want to make sure that we continue to hit topics that are of interest to you, just as this was suggested by some of you. And Scott, you can tell by the participation here today that people were anxious to hear from you, and you've done a great job. Thank you. So before, I want to do a little bit of a commercial for all of you. Our Bandage Ball is going to be very different this year. It's a 15-minute online experience that you can tune into during the week of May 1st through 8th at any time that works for you. You're guaranteed to have a good experience. We were actually taping today. It's going to be funny. It's going to be heartwarming. It's going to be inspiring and very engaging in terms of telling some very short video stories of all Overlake has meant to this community over the last year and beyond, and will continue to mean. So we do hope that you will join us, so to speak. And you'll be hearing more about that, but wanted just to give a little commercial for that, because it certainly will be a different kind of bandage ball than many of you are used to in past years. So with that, I just want to thank you all. Mike, if you want to say any parting comments, other than we've learned, I think we've all learned a lot. I think we've all come away with good information.
No,
so with that,
just to thank Dr. Bonvallet. Yeah, thank you.
Absolutely.
Sure. And please feel free to reach out to me. I guess through Molly, for those that, I think there were some other questions that popped in under Teams. Truly, I'm happy to answer those, and thanks for all of your support.
Great. Thank you again, everybody. Have a great afternoon.
Thank you so much.
All right. Thank you.
Thank you.
Bye.
Thank you very much. Bye-bye.